been a pharmacist for 5 years, and there's two sectors of pharmacy: hospital and community pharmacy. So when I initially did my pre-registration year in hospital, as I qualified, I did a bit of community pharmacy and a bit of hospital pharmacy, so one day a split post. I eventually then went and worked for GP surgeries and worked as a practice-based pharmacist, advising GPs on what they should be prescribing and counselling patients on their medication. Then an opportunity arose a few years ago where I could practice as a pharmacist for 2.5 days in hospital, as well as develop my career as an academic, as a teacher practitioner for the University of Wolverhampton. I recently took on a more university heavy post, but still maintain my 1 day a week in hospital, as well as a 1 day a week in community pharmacy as well.
I have started off as a community pharmacist, and I started off doing a clinical diploma while I'm working as a hospital pharmacist, and then I moved on to do something called one-stop dispensing, which allowed me to work near the patients, spending all my time on the ward as part of the integrated team. And after that, I moved on to be a discharge pharmacist, and after that I moved on to a more facilitator role, and leaving some of the clinical practice behind, then work on how I improve the system to make sure it's safe for the patient to transfer from a hospital setting to go home or go to a different care setting. And from there I joined in the work about medicine management.
Initially I was a lead audit pharmacist, but now I'm a senior clinical pharmacist. So we go onto the wards, we have near patient care, we advise hospital doctors on what they should be prescribing, we rationalise the use of their drugs as well, we counsel patients on new medication, we intervene on any dangerous situations that may harm the patient. We then eventually do the supply, so we supply the drugs to the ward, but the role of the pharmacist is very much clinical. It's evolving more so than ever, so it's more near patient care at a ward level.
At the moment, I am the Deputy Director of Pharmacy, and my job role are specific looking after medicine management. Medicine management seems to be a difficult word, but basically it means that we need to make sure that's a safe system for patients to receive their medications, and that's including the prescribing, the supply, which is sometimes called dispensing, and administrations of medications within the hospital systems.
Well, in hospital pharmacy, it's very much a multidisciplinary team. So within the pharmacy department, it ranges from assistant technical officers to technicians and then pharmacists, and there's various grades of either of those roles. In the wider picture, we're working with nurses collaboratively, with doctors, consultants, dietitians. There's a whole range of healthcare professionals that you encounter in your daily activities.
We provide service from the simple outpatient dispensing, that you have a prescription from the hospital, come into pharmacy, have it dispensed, to a full-scale supply to the whole hospital for every single medicines that we need to use a supply from this department. We also provide the manpower that actually allow the pharmacists and technicians to go to the ward to see the patient face to face, provide counselling, answering questions, any query about the medications. If you're in the hospital, you don't know how they change your medicine, ask the pharmacist is the best things.
I've always been a very much an open, get out there kind of person, and I've always wanted to help people. And I think helping people with their medicines and getting the most out of their medicines is what's probably fulfilling to myself. And even just having a general conversation with the patient about how we can improve their lifestyle, how we can change the things that they do at home to make their health better is what's fulfilling for myself.
Pharmacy is a vocation. You're required to be inquisitive, a communicative person who also care for your profession and the patient that you're ultimately responsible for, which is patients or your client. And by doing so, it's very rewarding.
Well, they need to have science-based A-levels, so they normally require maybe 1 maths subject and 2 science subjects, so decent grades. They then need to go and study a pharmacy degree, so it will be a Masters of Pharmacy degrees, and there's a range of schools in the local area that offer that as well. And then once they qualify, they have to do their pre-registration year, and if they want to go into hospital pharmacy, they then need to undertake a clinical diploma.
It's a daily challenge. And the challenge is, some of it's about managing people, and lots of it's about manage the situations, answering queries, use my brain, use the knowledge as I acquired over the years. From the time I'm in university, every single part of the knowledge that I learn, I use them.
I've been a pharmacist for 5 years, and I don't think there's ever been a day where I can say I haven't enjoyed today as a result of my career. It was probably the best decision I ever made for myself.